until they get severely ill to go to the emergency room because they have no insurance. Imagine a world where income and health insurance determines your level of health. Does this world seem familiar to you? Unfortunately, it's the world we live in today. However, this is about to change through the passage of the Affordable Care Act. Everyone will be affected by the Affordable Care Act in some ways or the other. You all should know what this law will have on your life as an impact because you're all residents of the United States. After experiencing difficulties accessing healthcare, I yearn for a change in the U.S. healthcare system. As a student and aspiring physician, I have researched about the Affordable Care Act and what it brings. The Affordable Care Act will revolutionize the healthcare system in the United States. Today, I will talk about what the Affordable Care Act is and why it was passed, how it works, and whom it affects. First, I want to elaborate on what the Affordable Care Act is and why it was passed. The Affordable Care Act gives millions of Americans access to reliable and high-quality health care while keeping costs at check. During the 2008 presidential election, Barack Obama campaigned for change in the American healthcare system. He stated that healthcare costs were a threat to the economy and that healthcare should be a right for every American. Upon being elected in November 2008, Obama urged Congress to pass healthcare reform. So, according to Procon.org, a non-profit, nonpartisan charity, on December 24, 2009, the Senate had passed healthcare reform called the Patient Protection and Affordable Care Act. This bill was estimated to cost about $871 billion over 10 years. It required most Americans to have health insurance, and it extended coverage to 31 million uninsured Americans. So, now that we know what the Affordable Care Act is and how it works, and why it was passed, I'll talk to you about how it works. So, the Affordable Care Act keeps costs low, promotes prevention, and also makes insurance companies accountable by having numerous provisions. In 2012, Avik Roy, senior fellow at the Manhattan Institute, wrote in the National Review that the Affordable Care Act, or Obamacare as he called it, would require insurers to cover everyone, including those who are sick. This includes children, those already insured, and those uninsured. In addition, this means that the insurance companies are no longer able to deny coverage to those who get sick or those who have a history of getting sick. In addition, children up to the age of 26 can remain under their parents' plan, regardless if they are married or not. For instance, before, if you got into an accident and you needed treatment, you would not be able to get it because, well, you were a student and you didn't have insurance. Well, now you can. Okay. Additionally, insurance companies are required to use simpler paperwork because this is due to improving efficiency of providing care. Also, preventive care will be offered at no charge. This means that blood tests, x-rays, and immunizations will be provided free of charge and require no co-payments. Ultimately, this will reduce the cost of care and allow for early detection and treatment of health problems. So now that I talked to you about how the Affordable Care Act works, I want to talk to you about whom it will affect. Ultimately, the Affordable Care Act will affect everyone. This includes students, politicians, hospitals, and taxpayers. In 2012, Paul Starr, professor of sociology and public affairs at Princeton University, wrote in the New Republic that Democrats will have to face up to support tax increases to maintain the Affordable Care Act. This means that in the future, taxpayers will be having to pay more taxes to uphold the Affordable Care Act. Additionally, in 2012, distinguished journalist Meredith Wadman wrote in the Nature Journal that the Affordable Care Act will cut coverage to hospitals by government healthcare payments by $155 billion between 2010 and 2019. This means that hospitals will have less money to do research and solve cures. Ultimately, unfortunately, it appears that we're going to be having to sacrifice finding cures for the future to provide better cure now. So now I talked to you about whom the Affordable Care Act will affect. Perhaps it's time to wrap things up. To reiterate, the Affordable Care Act will revolutionize the way the United States healthcare system works. Today I talked to you about what the Affordable Care Act is, why it was passed, how it works, and whom it affects. There's been a lot of controversy over the Affordable Care Act. Some think it is a change for the better, while some think it is a mistake in the making. John Wooden once said, "Failure is not fatal, but failure to change might be." Remaining stagnant on a system that was not at its best would not have led to good results. So today, instead of bickering over the Affordable Care Act, I believe that it is up to us to remain knowledgeable on the Act and improve